It's very confusing.
Okay.
From a healthcare perspective and from a patient level, you would definitely want to prevent. Early prevention would save you money, right? But the dental insurance company doesn't work that way. They work for profit. Their profits are by denying your care. They make money by denying your care. It's really confusing because you're thinking on a healthcare level, prevention saves you money. But for the dental insurance company, they want to deny as much as possible.
Welcome back. This is another episode of Healthcare Stories with Healthcare Henry. And this one I am super excited about. This is actually our first dentist, and those who know I am not clinical. I just give you the ideas, but to have professionals come and tell you and double down on what I'm saying or what they believe is number one for me. Everybody welcome Dr. Bridget White. Dr. White, welcome. How are you?
Hello, how are you? I'm good.
I'm good. We're super excited to have you. Of course, we want to get your life story and all that, but I want to tell people how I found you. So I'm always looking for people who are not afraid to say what they feel. And I think healthcare in itself has become such a lack of transparency. Everything's like, hide it. Just take all the money and don't inform the people. And you just didn't do that. And I found this post about you talking about insurance. And I said, we got to go get her. And we got to go, y'all go find her. And they wouldn't found you. So we're super grateful about that. Where are you from?
I'm actually from Philadelphia. And yeah, currently I live in Northern Virginia, right outside of Washington, D.C. And I've been here. I actually moved down here right after I graduated from dental school. I went to Penn for dental school in Philadelphia. I moved down here.
She's smart, y'all. She's smart.
I moved down here thereafter in 2007. I actually lived in Germany for 3 years. I was a contractor Army. Wow. And then I moved back here and worked in public health in Washington, D.C. In Washington, D.C. At Petworth near Howard University for 4 years. And then I opened my practice in Alexandria. And now I have founded my own oral care brand, Bright White's Oral Care, which actually reimagines wellness outside of the traditional fluoride and mint model.
What does that mean? Outside of the traditional fluoride? And also, let me say this. I look on Instagram or TikTok and everyone's like, no fluoride. It's terrible for you. And I'm like, well, wait a minute. Isn't it in the water? Right? Like, can you explain that for me and whoever else is like just ignorant on the subject?
Yeah, I mean, fluoride, I'm not anti-fluoride. I mean, I'm a practicing dentist and I was able to get the benefits of water fluoridation. On a public health level, water fluoridation was one of the biggest advancements of the 20th century. So it definitely did decrease our rate of dental decay. The caveat is fluoride is dose specific and there are some drawbacks. So there are cases where some people are hypersensitive to fluoride or they're getting a little too much fluoride. And so there actually are alternatives to fluoride. Other countries, I lived in Japan for when I was younger, when I was 10 years old, and they don't fluoridate their water, but they actually have really good oral education and they teach children about the benefits of, good health, good diet, and the benefits of fluoride. And they also offer products that are fluoride alternative. So there's something called nano hydroxyapatite, which was actually made by us. The United States made this for NASA back in the 70s. And then we sold it. We sold the patent because we had already decided that fluoride was going to be the way for us to prevent decay. So my answer is that I think that we should have more choices. And I think that we need to evolve with the science. Fluoride is something that's dated for decades. And being a practicing dentist, it's not a panacea. We still have high rates of decay. And that is actually linked to the fact that we have limited access and equitable access. So there are millions of children that go without dental care. In terms of your concerns, there are millions of seniors that see the results of a failed system. And so I like to reimagine oral wellness as a holistic, your whole body, and getting something that's actually consistent with your own biology, biomimetic, which is hydroxyapatite. You don't have those drawbacks of fluoride.
So what do they do then? Because if it's in your everyday tap water, right? Like, how do we get around it? How do we test? Now we're just asking, I'm just curious, how would someone know if they're hypersensitive to this? And if they were, what would they do?
Right. I mean, so generally, we have such a great, science-based infrastructure in the United States. This is not done nilly-willy the way that they fluoridate the water. They do it, it's actually by county. So it's state and then county because of the mineral levels in our huge geographic plane. And so it's fluoridated at a very, 0.7, it has a certain parts per million in the water. So if you're hypersensitive, it would probably be from like a topical fluoride, which is actually in the toothpaste. So fluoride works systemically, we ingest it, and as we grow, it makes our enamel more resistant to decay. And then we also have it topically in our toothpaste, and that helps to patch our teeth. The way fluoride works scientifically is it combines with the calcium and phosphate in our own saliva, and it makes a structure called fluorapatite, which is similar to our enamel. Our enamel's hydroxyapatite, but fluoride makes something called fluorapatite, and it does strengthen our enamel so it's more resistant to decay. However, it's an antibacterial, so it kind of is harsh on our whole oral microbiome. So most of the current science says that we need to keep a healthy balance. Like in our gut, our mouth, you can't kill all that bacteria because then you're going to be left with a deficit. So we don't want something as aggressive as fluoride. We want something that mimics our own enamel, and that's what hydroxyapatite is. So the nano hydroxyapatite, which is going to be available in my products, my new line comes out July 15th. Your body it's just natural for your body. And so you only take what you need.
Okay.
But yeah, in terms of your risk, it's not something that, everybody has to worry about. To be honest, like, you can edit this. There are some areas in the United States that aren't fluoridated and children get well water. Okay. And then they get fluoride supplements. And so their dose of fluoride is not measured and controlled. And so what we see as providers is sometimes some children, they got too much fluoride. And so they have something called fluorosis, where they may have a patchy work in the enamel structure. Sometimes it makes, your teeth a little soft and you get more cavities, but that's very, very rare. I've been practicing 20 years and I can tell you how many patients I've had. On the flip side of that, it's more that patients are unable to go to the dentist. I've had patients across demographics, patients from Utah, for example, who had to travel an hour and a half by train to see a dentist. Okay, so then when I see them as senior citizens, they're missing several teeth, they're wearing dentures and what have you. So for me, it's more about access to care, not anti-fluoride.
So when you're talking about health, that to me is health equity in itself, right? Being able to, and everyone thinks health equity, they just think like a hospital. But even in hospice, we see people that have had tooth problems that have led to much bigger problems. You're talking about infections. So where if these people can't get to the actual dentist, then this is going to be an even bigger issue down the line. And just for my own curiosity, how often should someone actually go to the dentist, and what should that regimen look like for the average person?
Yeah. Well, I'm glad you brought that up. 6% of ER visits are actually dentally related. So we actually keep patients out of the ER. So in the best case, we want to work from a prevention standpoint. We want to prevent problems before they become emergencies. So in dental health, our insurance typically dictates that 2 visits a year for prevention is adequate. And, in terms of taking an average.
What's your opinion?
I think honestly, you have to see it on an individual level. I mean, everything from, your own history of access to care, your oral hygiene habits, your stress level, your genetics. I have patients, I worked at the Watergate and I saw some of the most affluent families in the world.
Right.
And that doesn't dismiss anyone from having maybe, a low pH in their mouth. Maybe their saliva is not neutralizing things. Women go through, we're finally talking about women's health. Women go through tons of fluctuations with their health. In pregnancy, they have a high acidic environment from nausea or hyperemesis. Senior citizens, like you said, dental decay, dental disease, periodontal disease is connected to diabetes, stroke, Alzheimer's. As we age, our dexterity. My father, he passed 6 years ago, and he suffered from Parkinson's. He never had a cavity till college, and then in his aging years, he lost several teeth because he wasn't able to actually do his hygiene. So it's an individual level. And that's really one thing I want patients to understand. It's in the best case, you can advocate for yourself, right? You can go into the dentist and say, hey, I have this problem. Maybe I got some research on it. But a lot of times, certain populations are either dismissed, whether it's just based on time or access, or they don't understand, they don't have anyone advocating on their behalf. I've been practicing 20 years, and one of the things I noticed when I started my practice is patients were telling me in this area that they came to see me because I'm Black. I had Black patients telling me they sought me out because they wanted a provider that looked like them.
How do you feel about that? How do you feel about that? Be honest. We're a Black hospice. I'm be honest with you. That is number one reason people reach out. How do you feel about that?
Well, the science is there. There's tons of science that proves that patients actually have better outcomes with providers that share their background. I mean, this is a cross race, right? So the caveat is that Black dentists are severely under-indexed. We only represent 3% of the dental workforce, and that's not consistent with our national population of 13%.
13% of all Americans, yeah. And that also doesn't mean that 3% is where those 13% actually live, right? So back to your other point, if they can't get to you, we got a whole nother issue.
Right.
When you're talking about dentistry in the Black community, because you've brought it up, I'm curious, do you see a huge difference in what is being accepted or denied by the insurance companies?
I mean, so generally, I think we need to look at greater risk, right? Okay. So Black and brown communities have a higher incidence of gum disease, of tooth loss. Well, it's social determinants of health. It's history of what you had access to, what type of healthy environment you grew up in. Did you grow up in a food desert? Did you, have nutritional sources? So dental decay is a product of carbohydrates and being alive. The only way to fight it is actually oral hygiene and treating the problems before they get bigger. So in terms of an insurance denial, I don't think insurance, I would, I'm not going to litigate that dental insurance, works by the race. I think that they have their policy is not necessarily racially blind, but unfortunately, several of the needs of our underserved communities are not getting coverage.
Is it a lack of education, lack of information? What is it that is halting this particular social group from getting what other social groups can get?
I mean, I think it's systemic. So, just something that I appreciate about oral care, oral health is that the mouth mirrors the body. And also oral health is a mirror of, the disparities of, in oral health access. The disparities in care is a mirror of our society. So we can see people individually and say, okay, this patient is a Black man, 75, blah, blah, blah. We can look at the history. We can look at our history of segregation. We know that regardless of who was in the workforce, some dentists, even if they had goodwill to help people of color, they faced barriers, right? So I still have patients alive who remember going through the back door to go to a dentist, or having to wait hours at a dental clinic because they didn't have dentists that would see them because they were Black. Not to bring in entertainment, but Chris Rock has a line in one of his stand. He says his mother grew up, I believe, in Alabama or Mississippi. He said she had to. So the policy was because if there wasn't a Black dentist who could see you, you had to go to a vet. So you couldn't go to the white dentist. This is the policy. These disparities are our disparities as a nation, federal level and then state enforced. And so we have to appreciate that history. We can't ignore it. We can't ignore the past, and we have to understand the health implications and the current disparities that we have because of that.
When you say vet, I want to make sure you are saying veterinarian, right?
Yes, veterinarian. Yes.
You know, when I hear these stories, I'm 37, and my granddad, he just passed about a month ago. He lived to be 98, and he's one of I have longevity on the men's side. So much doing it. My mother passed. She was about 60. But one of the things that I think we forget is that when we talk about these events in history, specifically my generation, I think they're talking as if these things happened light years ago. And the reality of it is my grandfather lived through some of this stuff. And so to hear that story in his lifetime, which is pretty much minus 100 years, right? You're saying that people actually Black people were sent to a veterinarian if there were no dentists available is almost, and unless I'm missing something and maybe you can fill it in for me, you're not saying that a person who works on the teeth of other mammals or whatever is that different. Is that what they're saying? Is that your opinion as well? Or is it just really asinine to you?
I think that these policies that existed, the Jim Crow era and segregation, were founded on hate. And unfortunately, that level of discrimination, it may have been like policy written to protect the emotional safety of a certain population, but the same people that wrote those policies have had access to the science, and they know that human beings, that race is a social construct, right? Mm-hmm. We understand DNA, we understand biology, we understand biochemistry, we understand disease process. Dental disease is actually quite sophisticated. It's not new. It's not new to the 20th century. This is one thing about dental health is that it's very dynamic. And then dental care is also highly evolved. Practicing dentists are coming out and they're placing implants. They're, lifting bone and grafting new bone. They're regenerating things. And so our care actually, our coverage of that care and our access to that care needs to be consistent with what's available and also the intentions of the oral care providers. We want to provide care. We're trained to fix problems and provide care.
Sure.
The caveat is that we're faced this resistance by the insurance company that dictates care. So healthcare would be prevention. I want to prevent you from losing your tooth. I want to prevent you from needing a denture. A denture is not inevitable. It's a result of a failed system. If the system worked, we would keep our teeth.
So one of the things that I've heard multiple times is that dental insurance across the board is a scam. They say that you pay $40 a month for some people, which is $480 a year. And the reality of it is, if you just went to the dentist, a lot of times you could just pay, because they still have copays even after paying $480 a year. They could just pay once they got there. Is that something you would agree with as well?
What I would say is that it's really confusion. Dental insurance does not work at all like medical insurance.
Please explain. Okay.
Yeah. So dental insurance is more like a coupon, right? Like, hey, I have this coupon. I can get I can get a cleaning because I've paid into it. I can get a cleaning, maybe two. And then if I need something more, maybe I'll get a little percentage off. Whereas medical care, if, God forbid you actually need, severe care, it's covered if you pay for your insurance. Dental is almost like the opposite. And then it's not that I don't like the word scam. It trends and it's helpful in terms of social media.
Well, I mean,
but what I would say is, excuse me?
If it's appropriate.
Well, I think on a provider level, people don't realize we suffer, right? So we invest, the average dentist is graduating now with $500,000 of student debt. That's just student debt. We go to school for 4 years after college. We do residencies, surgical rotations. More than 80% of dentists run their own office. So essentially we run a medical practice. We have to comply with all the OSHA, HIPAA, and the regulations that keep us safe. We have payroll. We have to stay up to date with the technology. And then our dental insurance, if it reimburses, if it covers, it's based on a 1970 model.
What does that mean?
So the same max benefit of $1,500 average, right? That's the average maximum for PPO coverage. That was the same max in 1970.
Okay, so that's pre-Henry Mason Jr. I was born in 88, right? So what you're telling me is that they're expecting you all to fix the same problems for the same pay that we had in 1970s. Now, from a business side, right? It seems to me that, and this is where I guess I get to, this is malicious, right? And this is me saying this because business-wise, it makes more sense to do preventive care. If I'm an insurance company, right? And I'm running the insurance business, and this is how people have their own thoughts. But as a business owner, it makes more sense financially to keep you out of the hospital and to make sure that you're actually well as you live life. Why is it that we're doing the opposite? Like, what is that? Is that just malicious? Because it's not a money thing, because that doesn't make sense, right? So what is that in your opinion? Why are we doing this?
That's a common question. And it's very, very, it's very confusing.
Okay.
From a healthcare perspective and from a patient level, you would definitely want to prevent. Early prevention would save you money, right? But the dental insurance company doesn't work that way. They work for profit. Their profits are by denying your care. They make money by denying your care. And they also have a short view of a patient. Most patients, they jump from job to job. And so they don't have dental insurance that long. Maybe some federal employees, but the average patient, hit or miss, they have insurance, they didn't get it, they missed the enrollment period, it doesn't start till July, all these, loopholes. Mm-hmm. So the dental insurance company says, I'm going to try to even deny prevention. And then later on, the next insurance company can pay for it. It's really confusing because you're thinking on a healthcare level, prevention saves you money, but for the dental insurance company, they want to deny as much as possible. So they rather deny that prevention.
Yeah, that seems malicious to me because if you're telling I can tell you, we have hospice patients that, I can say it like this, their dental care or lack of dental care has affected their overall health care down the line, right? So we have patients literally who get these massive infections and it becomes infecting their blood. And by the time they get to a hospital, it's already too late. Okay. So, but my opinion is I'm only seeing this in minorities. I'm not seeing this in certain areas where maybe they're going to dentists where they're not being denied, or if they are being denied, they're just paying out of pocket. So I guess my real question is, why are we paying for dental insurance? Like, what is the point?
It's
you don't know. Okay, I got you.
It's capitalism, right?
Okay, I got you. I just was curious.
Yeah. But I would say, it's also worth highlighting the wealth inequality, right? So your average, I have a doctorate. I have 2 Ivy League degrees. I went to Princeton University. My parents went to Penn. I'm an Ivy League legacy, right? My parents, I'm just putting it out there now so people understand how wealth is actually health.
Sure.
Now, my parents gave me and my 3 sisters as much access as possible. We went to the best schools. We did competitive sports. We lived abroad. We got cultural capital. We were able to even volunteer. And I was a candy striper when I was in high school. I worked in the Boys and Girls Club. My parents gave me access, but there was no transfer of wealth because of our history of, federal housing discrimination in banking, segregation. We can go back to the Homestead Act, all that transfer of wealth that white populations got land for free. With the Homestead Act, that there's science and now there's literature that shows just that act plus Social Security, and redlining, like all these things, we know that led to white families having more money. Right. So my son, I don't have this nest egg that has been appreciating and growing. After the Civil War, we know that the 40 acres and a mule didn't get to most of us. And then on top of it, any wealth that we had was often burnt down. So we have to acknowledge America's history to look, at our current state clearly in the eye. It's not that there's several white families, other populations that I've seen patients across race, again, white, Asian, all patients in poor health, right? So it's not necessarily that other populations aren't having bad outcomes. I think especially if we are looking at you live in Atlanta, you have a large Black population, and so you're able to appreciate what's going on with our community. But it is really a class issue, but class and race are very much linked in America.
I would agree. So the only thing that I would say that, yes, all these things have happened, but there is one thing that I see consistently in hospice as it pertains to wealth bridging or giving generational wealth down. And I think this is where a lot of us miss the mark. Yes, these things did happen. I agree. But I am a huge proponent of life insurance. And I think that when I see families, whether they have a house or anything like that, I can see a family that has income of $3,000 a month, $4,000 a month. Those parents have a $2-3 million life insurance policy that is going to be given to the children. And I don't see that a lot in our community, right? Because we see everything. And that's one of the things that we're constantly trying to tell people is like, hey, you can't wait, right? You're waiting. Like, oh, it's the cheaper the earlier you start it. So that's the only difference, that outside of the other things, the things that we can control that we need to get a head start on, is that we don't take advantage, if you will, of the life insurance policy. But other than that, I'm totally with you. I do have one question though, because you're talking about water and systemic problems with what happened in Flint, Michigan. I'm sure you're very familiar with that. I gotta ask, long term, what are the constituents of that area? What are they going to be faced with? What is it going to look like? How do we help them? What can we do to help them? What are they really looking at in the next 5, 10, 15, 20, 50 years?
Yeah, I mean, I think, we'd have to look at the research that's going to grow from looking at those populations. Anytime something devastating happens to a population, especially when it's controlled and we can look at it on a map. We have to follow it for years. But I think the fact is that infrastructure already had cracks, right? So you have a population that was already underserved, had limited access, had food deserts, health deserts, as well as bank deserts. All those things are consistent with them, having the tools for prevention. So you have to look at, the water crisis up against a frame that was actually supporting the actual people. And so, we'd have to see what happens over time. I think there's going to be a lot of opportunistic problems that are going to occur, or that are going to manifest, that we're going to be able to see. But from an oral health level, prevention comes in so many different ways. Like I said, water fluoridation is a public health measure, but going to the dentist. So let's say you're anti-fluoride. Let's say you can just completely get rid of water fluoridation. It's hard. It's hard. Like, there are people like, can I get the fluoride out of my water? It's almost impossible, right?
I would imagine so.
Let's say you were anti-fluoride. Then how do you fight dental decay? Well, number one, you actually need to remove the debris. You need to remove the food, the carbohydrate. You need to keep a healthy mouth. So you need to have access to, like you said, water. You need to have access to fresh fruit and vegetables. And you want to have overall good health, right? Because we know that oral health is connected to all these other issues in our body. So gut health is connected to oral health. Something as simple as even our GI system and sensitivities that people don't even realize are connected to bone loss is actually, linked to, problems with our gut, But
I didn't know that.
Yeah, that's the thing. Dental oral health, if you were to visit a dental school, there's so much research. There's so much intellectual property being developed. These studies are monumental. It's not the provider level. We are actually outpacing what we're delivering. That we're being up against an economic structure that, for a lot of other reasons, is failing people, and it seeps over into their healthcare. But yeah, to just give you some comfort, if you didn't have clean water, you were able to go to the dentist to detect problems before they become bad. That's a huge thing. I can see a cavity that's starting early and even try to reverse it or stop it, right?
What can someone do at home to try to reverse it?
They can use repair and remineralization products. And that's why I'm not anti-fluoride. Fluoride is what's available in, most people can't even think of an alternative. So now, because of globalization, we have Amazon. We can buy hydroxyapatite from Canada, from Japan. But your average patient who gets their Colgate from the dollar store, they are going to have that fluoride, and that's what's going to help them. I would still stand by that versus nothing at all.
Okay, that's fair. So I'm going to give you my routine, and I want you to be blunt and brutally honest.
Okay.
And I know what people are going to say, but I'm going to say anyway. So I have my water flosser that I love. I have electric toothbrush. I go medium, not soft, even though my dentist has mentioned soft to me. I just feel like soft is too much work, right? So I have the electric medium one, and I use hydrogen peroxide about twice a week as a rinse. Then I have my regular rinse. But here's what I do. So I wake up in the morning, I drink, before I do anything, I drink about maybe 1.5 bottles to 2 bottles of water. Now, to be honest with you, as of late, I've been doing carbonated water because it makes me, for whatever reason, I just feel so much better after I do that in the morning. So whatever the Pellegrino thing is, it's in a glass bottle. It's like green or something. I drink that, 2 things that are about this size every morning. And then I go to my water flosser, but I don't put water in it. I put mouthwash in it. And so I use that I need to be brutally honest.
Which mouthwash do you put in it?
Golly. And it's not Listerine. It's in a round bottle. I cannot think of it. It's relatively.
Is it by Crest?
No, it's not one of those. I'll try to find it.
I know. Is it Doc TheraBreath?
Yes, yes, yeah. And I use I think it's called icy mint. That's what I use.
Okay,
so it's like $9 a bottle. I know it's ridiculous. I know it's ridiculous, but I really love it. And I put it in my water flosser. So I do that. I brush my teeth, and I also have a tongue scraper, right? Which I've also thought was ridiculous, but dentist was like, you need one. And I'm like, well, it's just like takes the white stuff off my tongue, but like whatever. So now I'm trying to say, okay, so I do that. And then I have a whitening strip that I use once a week, preferably on Sundays, because I can't eat for like 30 minutes after that. But my whitening, and I use whitening toothpaste. Is that the right way to do it? Can you help us understand how we're even supposed to do this? Because I think we don't even know. We think we know, we have no clue.
Okay. Well, one question.
Sure.
The whitening toothpaste, is that what you use every day?
Well, it says I can use it every day. So yeah, I use it every day.
Okay. Yeah. Okay. So number one, your routine sounds fabulous. Like I'm giving you an A+ because first of all, you're aware that your mouth needs to be cleaned. Okay. This is number one. Number two, you are using so many tools to your advantage. I'll just start in order. I think hydrating early is brilliant. I do it too.
Even carbonated water is okay.
And I lived in Germany and we drank mineralized water, carbonated. You have to look and see what kind of carbonation, but we, as dentists, we'd rather you have carbonated water than, a Coca-Cola, right? Or orange juice, even. It's acidic. So water, I still would say that's good. You're hydrating, getting your body flushed. Okay. That's good. Number one. Number two, you're using powered products. Okay. Why not? I tell patients now, hey, let's go with the powered. We don't walk, we drive. It's okay. There's no matter what, your hand can't rotate, 25,000 times. Mm-hmm. That's number one. But the other thing is tongue scraping is very, very effective. A lot of the bacteria sits on the back of our tongue. It leads to bad breath. And it's, in the best case, the back of your toothbrush will help it slough off, but some people need a little help. Okay. So that's effective. Okay. But what I would say is one modification is your powered toothbrush. We like soft. You deserve, this self-care is really important. Take your time. It should be a light massage, not scrubbing, not aggressive. People think of their biceps and they're in the gym doing push-ups and they want to flex. No, this is just a light massage. And then finally, the TheraBreath is wonderful. It's actually made by a dentist, and he has a lot of great ingredients: castor oil, antifungals, antibacterials. And so it works. It's not too aggressive. It keeps the balance we talked about the oral microbiome. We want to keep some of that bacteria, some of that, those viruses and those cells intact. And so that's not too aggressive. The hydrogen peroxide, if you're doing it twice a week, I think that's fine. I mean, hydrogen peroxide is an antiseptic. It's been used in medicine for hundreds of years. It's fine. I tell patients, sometimes I advise them if their gums are a little inflamed. In your case, you're also using the whitening toothpaste. And over-the-counter whitening toothpaste, it's only going to have so much hydrogen peroxide. So I think it's safe if you've been seeing your dentist routinely and it's okay for you. That's the whole point. You're using all the tools. You're using the dentist insight. You're using your home regimen, and you're also staying abreast as to what you have access to. So I give you an A+. That's wonderful.
I appreciate that. Thank you, Doc. Thank you. I appreciate that. And so I guess when I do it, so let's say I did this for 30 years, 40 years, whatever. And if I were to just come to you now and say, hey, I want you to treat me, could you look in my mouth and tell my whole life story?
It's funny. We actually see a lot of social behaviors that reflect in the mouth. And then, yes, typically we can tell patients that had access to care and that have had good hygiene regimen. Very, very rare. I've never seen a patient that never saw a dentist and didn't brush their teeth and had a healthy mouth.
And so if you've never seen that, right? Is that because of the area you're in? Or is it the person that doesn't do those things doesn't go to the dentist anyway?
That's a good question. Even going back to when I was a student in dental school, we saw, dental schools are hubs. So they get patients that would otherwise not have access. And I saw a 100-year-old woman, African-American, who had all of her teeth. I don't even think she had a cavity. So there are a lot of factors. There's genetics, there's stress, there's access to care. And the other thing is I've seen West African patients who may not have used a traditional toothbrush, used a miswak stick, right? Mm-hmm. And other antimicrobials, but didn't eat processed food all day, like Americans. I have a 12-year-old son. He loves candy, as do I. Okay. Americans consume the most candy in the world, right? So we're a country that makes Frito-Lay potato chips. We make M&M Mars candy bars, but we don't give children, in terms of across the country, children who do not have access to dental care. I mean, it's devastating.
I never thought about it like that. Yeah, you're going to give them a candy that's 50 cents. Hell, it's not 50 cents no more. It's like $1 or something. And now not help them get better from that. And understand.
Mm-hmm. When I was in Japan, I went to public school in Japan. I was in 5th grade, and we brushed our teeth after lunch. We actually served the lunch as well. We went down to the basement and brought it up. Everybody had lunch, and after lunch, we went to our cubby with a mug and a toothbrush and brushed our teeth. We had a dentist in the school. You
have an interesting background. When you say you studied elementary school in Japan, were your parents in the military or something? They just sent you, you're a bad child, you got to go away. What happened?
It seems like that. My mother, so I'm not from military background, but my mother is an English teacher, and she had an opportunity, to work abroad and in an exchange program with Pennsylvania and Omiya City, which is an hour north of Tokyo. But her condition was that I'm only going if I can take my 4 little girls. And so because we couldn't afford the American school, my mom's kind of a hippie, kind of like, hey, it's fine. It's better for the cultural exposure and we'll supplement. But my school did have, I had an English speaking classmate. She lived in New York. Her father was a businessman. And she lived in New York for 5 years. She spoke just like us. So the irony is Japanese kids start learning English. They were writing their Latin letters in 4th grade. So they start learning English in 4th grade. They learn to speak and have conversational English by high school, and they have a dentist in their school, right? And they have fluoride alternatives. Whereas in America, we're the wealthiest country in the world. And we have a history of people that were cut off from care, cut off from education. And now we see, centuries later, a devastation, a crisis in oral health that not only affects people, but our GDP. If we corrected 100%. Oral care, we would have more money. But if we don't call out these systems, I study policy. I know it's idealistic. I understand how the bottom line, I was a contractor for the Department of Defense for 3 years. So I understand. However, we still need to call the system out. We can't just sit and say this is okay. And unfortunately, I do have to advocate for dentists. Dentists are burnt out. We have high suicide rates. I didn't know that. Yeah, it's also a crisis on our level. And many people are misunderstanding the dentist. What's the word? Our MO. They actually associate us with that dental insurance model, and we're actually outside of that. We're just trying to keep things afloat.
So you all are actually pro people, not pro profit.
Oh yeah, because I'll tell you, I was very even idealistic becoming a dentist. My parents were like, you have to go to grad school, right? You got to be a doctor, a lawyer, engineer, something. I was like, okay, I'll be a dentist. Everybody has teeth. I'll always have a job. And then I could see that dentistry could be everything from public health, working in emergency settings, to cosmetic, what we call aesthetic dentistry and complete rehab. I saw the whole window. I had no idea that working middle class people were buying into a system that was failing them.
That's a whole nother conversation. But I will say, America's biggest issue over time is going to be they're stripping everything from the middle class. I've been saying this for years. And when I watch this thing, right, we had these three separate groups. We had lower, middle, and higher. And now it's just becoming this one in the middle. It's just kind of like this. It's slowly shrinking in so that thing doesn't exist. And what I find is that a lot of people who are in this middle space are even voting for Republican because in their mind, they're saying, hey, the people up top have everything. So they don't need help. They can, if they needed to pay for chemo out of pocket, they could. The people at the bottom have everything because they need so much help. Y'all give them access to everything. You all make us work our asses off and then make us pay for everything. So when you look at that with these types of people, right, this middle class in America, which in my opinion, as they shut down things like Job Corps and take away plumbing and electrician school and HVAC school, which is a whole other thing. How will we be able to help these people? Because they're paying for this dental insurance, which might be $50 a month, which they're no longer going to be able to afford. They're not lower class, but they're not at the top. Is there a way for dentists to say, hey, if you want help, I can charge you $200 a year and knock this out for you? Like, does that exist?
Yeah, that's a good question. Well, first of all, there are fee-for-service offices all over the country. That's actually that's actually almost like it's a staple in dental care. You might go to an office that doesn't take insurance, but there are also, each dental office usually offers opportunity to help patients finance their dental care. So we advocate for patients. We can give you information about other insurance companies, or we can offer smile programs in our own office, right? Mm. So maybe you pay a couple $100 a year, your cleanings are covered, your emergency visits are covered, your x-rays, all of that. And then you can get discounted other treatments. So yeah, instead of paying an insurance company that may or may not give you coverage, you pay right directly into the dentist. And then, yeah, there are also, just like you can buy clothes with Klarna, there are credit organizations associated with healthcare. Care Credit, for example, they will help you finance your dental care. So sometimes dental insurance may cover you, but they make you wait 30 days, 2 months. Whereas you can go to a dental office and they say you need something today. If you want to save your tooth today, oh, you're in pain today, this is what we can do for you. And this is how you can pay for it to get the treatment today to keep your tooth.
Okay. And I'm just asking now for clarification, right? So because you've done the whole gamut, you had your own practice, now you're an affiliate of another practice. When we talk about, one of the things that we try to discuss with everyone, and this is going to be even more important for someone like you, is the business of healthcare, right? When you were in practice, is it actually profitable to be a dentist? Like, is that something where you can say, okay, I went into this, I made at least $250,000, $300,000 a year, right? And I'm just being honest, right? Is that something that, yeah, if you don't want to say it, that's fine. But the people, like, they ask me these questions. Everyone asks me, well, how you start a hospice? And I say, don't do it. You don't have $1 million sitting in cash. It ain't worth it. Like, I didn't have that, but I had to figure out how to get it in about 2 years, or I was going to be out of business. So, but with dentistry, it seems like there's a lot of startup. You guys got a lot of machines, got a bunch of chairs, you got nice office space. We don't have to have this shiny, crazy office space that has to be cleaned 3 times a day. Like, is it actually worth it to own a dental practice? So
first of all, I think that this is a common misconception.
Okay.
That dentists have a lot of money to dispose as they wish. Okay. So there are 3 things that I want for our audience to understand. So the cost of care is associated with the cost of actual care and delivery. And like you said, that includes the technology, the education, and all the fees that go into keeping an office, payroll, materials, all of those things. So when you're paying that money, even in a business model, there's revenue, right? There's revenue and there's profit.
Sure.
So what I actually collect versus what goes out. What do I recycle back into it? I have to uphold certain amount of continuing education, whether it's regulated by the state or from my own expertise. That costs thousands of dollars, right? So I think people also need to understand what they see on what's hot and flashy is not the average. So the other thing is, dentistry is a legacy profession. More than 50, maybe 70% of my colleagues, their parents were dentists, their siblings are dentists, they married dentists. 70% of the profession is white, 22 is Asian, and then you got the little scattered indigenous, Black, Latino. So a Black dentist who's first generation, maybe college, certainly dental, is not going to have the same take home disposable income as a third generation dentist.
But there is a number though. Like, is it worth it?
Oh, is it worth it? I think that really is on a human level. Like every day I help people improve their way of life. I increase their quality of life. And I feel like I am in some small way making the society better. You know?
Okay, let me ask you this. Is there enough money in it where you can say, okay, if I did this, like people can actually make enough, right? And the reason why I'm asking is because I see less and less people going to dental school. I do, right? And the reason that I'm hearing when I talk to people at different schools and things, they're always saying, well, I chose a different route because they didn't think they can make enough money. Like, is there actually...
You're talking about return on investment? So 100%. I would certainly, I would go to law school and be a corporate lawyer. Yeah. I wouldn't be going into healthcare is kind of, to me, I was idealistic. I thought everybody had teeth, but to me, it's a gamble. It's so many things that you can't control. Nobody questions the Wall Street broker as to whether they make enough money or did they get something back. They take certain tests, they go to school, they work through school. In a pandemic, I still have to pay my lease, my mortgage, my student loans. Then I have to risk my health. I have to leave my house to work. I can't work from home, like you said. So yeah, and if it's just purely financial, I wouldn't. There are something called entrepreneurial dentists. They just own practices. So dentistry can just be entrepreneurial and non-clinical, and then it's a business model that probably is not. It's not interpersonal, right? So I still have to talk to my patient, and patients will ask me in my face, why does this cost so much? Does my insurance cover it? I can't even get away from that. And that really also wears on us because unlike a hospital where your bill is on, floor 1 and the doctor's on floor 7, I'm somehow the face of all of that. And They even think I work for the insurance company. The irony is I don't get paid time off or any other benefits. And sometimes they don't even pay me.
So, and this is why, I guess, so it is some of the reason as to why you transition to sell your practice, because entrepreneurship is a lot, right? Just being honest. And one of the things I always talk about, that when people talk to me about entrepreneurship, I have unless you've experienced payroll every 2 weeks, you don't really understand it. Like, not now, but when you're first starting out, and you're talking about, you got defined, for me, it was like $35,000 every 2 weeks. And there were months where the government didn't pay me. And for whatever reason, 6 months at a time, I didn't get paid. So you had to make that every single time. Did that also influence your decision to say, hey, I need to get out of this, or it's just too much, I want to spend more time on my son? Because I don't get to see my son as much as I would love to because I'm always at work.
Yeah, you made a good point. And it's not just from the beginning of the practice. I've talked to retired dentists who actually said payroll got even more challenging towards the end of their career. We can't change the fact that we live in fluctuations of the fact that wages are from the 70s. They didn't change, but the cost of living has skyrocketed. So that's number one. Number two, dentistry is also very physical. So there's that emotional stress. and financial stress, but also we use our body, our back,
You're
our
right.
neck, our hands.
You're grinding.
Yeah. So, and then luckily I've been healthy enough to see, when I was in public health, I saw patients a day, so, but also I was a late bloomer with healthcare. I didn't decide to become a dentist till 2 years after college. And I actually had background. I worked in big pharma litigation. I worked for I always was interested in having my own products, and especially being idealistic, thinking like, can I make a product that works the way I want it to, that patients actually feel good about? Often they're scared of the dentist, and then they associate the dentist with pain. Whereas I want to have a wellness product like beauty and skincare that makes you feel good, that you can introduce into your regimen that you just described, and that brings joy. And I think,
I love that.
That's what I want to do.
I love that. And so now you're starting your own company.
Yeah.
So I haven't gotten these samples, but that's fine. Are you actually, can you explain to us what it is? Like, really explain what it is that you're doing and why you're doing it.
Yeah. Well, first of all, I'm going to send you our rebrand samples when they arrive. They're actually coming soon.
You don't have to. We'll buy them. It's fine.
No, definitely. I would really. It would be. It'd be grateful for you to give me your insight. But yeah, one of the reasons, what is my brand? So it just turned. I guess we just had our year anniversary.
Congratulations.
Thank you. And it kind of dates back to the fact that when I started online, I started social media when my son was born. I was working at a maternal care center, and I saw mothers and children, and I realized that, patients are always asking, like, is this good for my child, or how can I brush my son's teeth? And when I had to brush my own son, I was like, dentists are like, oh, just do this, just do that. But it's not that easy. Mm-hmm. And so I started making oral care educational videos. And then I started looking at the products, and the kids' products are always fun. They're associated with superheroes. They taste good. We're always trying to do what we can to make kids enthusiastic and excited, because how they begin their oral care journey is usually how it ends. And then I thought about, I actually I worked with Arm & Hammer and helped them relaunch their spin brush. Mm-hmm. And so it gave me, experience again with the corporations. And then finally, I decided, my business partner, who is actually an intellectual property lawyer, he's done all my trademarks. I've written children's books, and I've done a lot under the Bright Whites, Dr. White's Bright Whites by Dr. White. And he's always registered all my intellectual property. He's like, why don't you just come out with your own products? Mm. And I was like, oh no, I want to get away. I don't want to be the face of a brand. And then I thought about it, and I was like, you know what? This can be my medium to educate, to still stay connected to the industry, and to advocate. And then also finally bring joy. And I think that one thing, people often associate the dentist with the dental office. We're very sterile in the corner, but we're people too, so it's an exciting venture, and I'm really excited for it to grow.
Is there anything that can we get it now? Can we pre-buy it? Is there a way? Is it a website?
We actually, our new line is coming out July 15th, but currently we have our OGs on our website, brightwhitesoralcare.com. Okay. And our three flavors are Cherry Crush, Pineapple Splash, and we still have Minty Fresh. So moving forward, we're going to be fruit centered, and it's still formulated by me, and we're going to use the fluoride alternative of hydroxyapatite. But right now, you can still get our products that are currently available at brightwhitesoralcare.com, and follow me for updates. Yeah, we're going to I'm really excited because it's perfect summertime for our flavors, which are tropical. I'm not going to give too much away because every week I'm announcing a new flavor.
Okay. And people can just buy it and you can just get it right away. Is there a subscription service as well?
We do have a way for you to subscribe. But it's available on Amazon. We have a Shopify site, so we can get it to you just in a few days.
Okay. Are you guys looking for investors?
We are, yes, we're coming out of beta, and definitely that's another reason why I need time to actually share my story for investors. And I think that I like I say, Rihanna Fenty, went into beauty, and I think that it's time for oral care to diversify. And I think that my mother's always like, use your experience, tell people what you've seen in your own life. And I think that also opens the door for people to look at oral care as a as shelf space that isn't so sterile and homogenous. Let's make it spicy, let's make it fun.
I love this. Is there any last words you have for everybody? Is there anything that they need to take away from this? You talked about everything from racial inequality. You talked about how long we've got to go in terms of how far we've come. You've talked about building your own practice. Now you're talking about building your own beautiful company. And for one, I'm super excited. I am so excited for women to start their own businesses. Like I'm even considering starting a school specifically to help women start businesses. I believe in my heart, you all are the most attentive. So attentive, you're caring, you're loving. And I think when we have people who start businesses who are not just strictly about the numbers, it makes for better outcomes, particularly in healthcare. So I'm super excited about this. But is there any lasting thing you would like to say, that whether it be about you, your upbringing, the industry in general, just any last words for everybody?
Well, I think, just to piggyback off of what you said, as a woman, there's certain things that often are associated with gender. Women are nurturing. We're natural providers. We advocate for our families. Women are more likely to schedule doctor's visits for their spouses, for their children. And so for me, oral care is really about wellness. And so wellness is so many things. It's not just, physical, it's emotional. And now we have technology. We have access to providers using their voices about the history of inequity, history of inequality. And so what I would say to, your listeners especially, is to have an advocate. If you can't advocate for yourself, bring your son along, bring your niece, talk to the doctor. You can find, it is hard sometimes, but if you do not feel comfortable with the provider and you want someone that you feel is addressing your needs, ask for it. Speak up about it. There are policies, believe it or not, there are policies for safe healthcare. And that's one aspect of it. We can only do our job if we understand your symptoms. And that needs to be often communicated to us so that we can, get to the bottom of them.
Got you. Well, we appreciate you, Dr. White. We want to thank you for having you and for being transparent. I think that's the number one thing that we don't get from this industry, and we're trying to promote transparency. We're calling pulling back the curtain, if you will. So just being able to do that, I can't thank you enough. And it was definitely a pleasure to talk to you.
Thank you so much. Thank you, Henry. I had fun. You guys have a great weekend.
All right, you too. Thank you.
Bye.
All right, bye.